But when I went to the expert neurologist in Manhattan at Columbia Presbyterian, they said there's only about 2,200 cases in the world that we know of. I'm sure there's people that are just like, I have this clicking, I don't know what it is.
Right.
And they can't, and they may go to a doctor and a doctor says, I don't know what it is, because it usually takes a couple doctors before you even get it diagnosed correctly.
Yeah. Took me at least 6 months.
Yeah.
And I kind of figured it out on my own, on the internet. When I went to the NIH, I told them what I had, and they just confirmed it in their own way. But prior to that, I had been to some serious doctors, and they were like, you don't have that. And they were saying, I'm just going crazy. I'm like, no, I'm not going crazy. I'm going crazy because of the way I'm feeling. That's the only thing driving me mad. I'm a very outgoing, happy person normally. That's just my demeanor.
Yeah.
So that was taken away from me, and taken away from my family too. So since I've been here, need I say any more?
Yeah.
Finding Heather first to her video, which when she came here was the miracle that I had, the beginning of the part of the miracle. And after I saw her video, like I had been looking for, I just told her this yesterday, for some drug online that I heard kind of helped somebody in Germany called Paractasam or something like that. And looking for her, my Uncle Harry from Hawaii found her video and sent me this link that said more hope. And when I saw the video, I mean, it was just overwhelming. It was like too good to be true. It just was like, am I dreaming? I'm pinching myself. Is this really real? And yes, it is real. And anybody that first gets here, the pain you can't put in words, the suffering you can't put in words, the torture you can't put in words. Nobody outside yourself would really understand what you feel and how you feel. And there's definitely absolutely real, true hope beyond drugs and medication, of actually getting to the core of what's going on and getting some real healing, no Band-Aids. And I'm a year and a half in now with this, coming here, and I'm back to myself, which is the gift from God. So that's where I end.
So for me, I would just say it's been like a really long journey. It's been like 22 years. And it took really understanding more about the body to then find you and know that what you were doing had to, in some way, at least when I first saw what you were doing, help me return to wellness and heal this without drugs. So I feel really blessed for that. When I saw your videos, I just kind of knew, because I'd had experience with a chiropractor before to heal a really long chronic condition, that what you were doing was really looking at how the brain and body work together and that individual person, and really trying to heal that individual person. And your assessment, things that you do from a neurological aspect, really rang true for me, because I had been to some of the world experts in this in New York City at the Parkinson's Disease Institute, and I saw pieces, but you applied it in a very different way, in a very bio-individual way. And I knew that the increase in oxygen had to do something to bring more nutrients and oxygen to the brain that would help it regenerate and work in its natural way, and hopefully move the skull back. And coming here, the first treatment was just instantaneous. That was the biggest movement for me. The ways that you feel like yourself again are just hard to put into words, because it's something that you would never expect could happen the way we're taught, naturally. It was just, and it was instantaneous the first time, and completely overwhelming after so many years feeling limited or blocked. And that's something that only someone that has palatal myoclonus would understand. I'm trying to think about what would be helpful to really know. I had been through so many levels of pairing different medications. Nothing ever worked. It usually only made me worse. And I think the hardest thing is when you go through a path of palatal myoclonus, to believe in something that seems so different is really hard, but if you just try it, you really have nothing to lose, and that's the kind of thing you have to take. Is you have nothing to lose to try something different, because I know it's hard when you go through doctor after doctor after doctor and nothing really makes sense or doesn't work, to trust something that would seem so new, but it's life-changing. It's life-changing. And an NCR woman that I write for this one magazine with, and that's how I found you, just looking at her.
Yeah.
And then I started looking online, and you have so many Google links and videos. I was like, this is the guy that's gonna
I watched
get
his
it.
videos of him flying, which I'm like, I want to do. That cool thing.
Oh yeah, the Hawaii stuff.
That's the stuff I like.
Yeah.
No, but I saw the other stuff that you were doing prior.
What else you said?
I want to say that you don't stand a chance unless you take a chance. And a lot of people, I belong to a Facebook group where I know a lot of people live in a dark area and they're afraid to kind of step out. And some of them do live very far away and understand it's a big chance. But the other side of it is you have to live this way. So I would get here by all means and give it a try, because it has helped me. It's got my life back tremendously. I know it's helped others, and I only think that it's going to continue to get better, because like Dr. John said, he's still learning and still learning more protocols to add on to this. So with each patient that comes and more that he learns, the more we all have a chance together, to, if not completely eliminate it, at least get rid of most of it, where you can just enjoy the everyday life again. And that's where I'm at right now. I enjoy my life every single day again. I'm not hiding in a shell or trying to stay away from people and not engage in a conversation because I'm so uncomfortable with my head. And and that's where I was. And I thank God over and over and over and over again and again and again for this. So.
And I would say that this is like the second serious illness in my life. I hate using the word illness because I just don't like the word, but imbalance that I've been told by the traditional medical community was not possible to get past. They're very set in one way of thinking. I'm not knocking that industry, but they're just not, they don't understand these other forms of healing. They don't understand that the body is able to come back to wellness and balance on its own. Through like what you're doing, giving it its tools to return to its natural state, through oxygen, through more nutrient delivery. It really wants to be well, but they're just not trained in that, so it's not their thing. It's not that they don't want to help, it's just that they don't understand the body that way. And so if you continue to stay in that world, you're just not going to get the answers or the hope or the help that you need. And eventually I'm hoping that from the work that what you're doing here and the information and the research that you're collecting with different people will begin to open that world more to these other forms. So more and more people are led to healing and wellness, because you're just not, like Chris said, you're not functional, you're not yourself, you're not able to do and be all the things that you could be, because it's so limiting to your head and your thinking and your clarity and your mood. And I've even found like sometimes I struggle with just tension and even more like just frustration, or maybe I have some days where I'm more aggressive, and I just think it's the palatal myoclonus, because you just constantly have this straining on your head. And so just muting that with drugs is not a solution. It's not going to ever allow you to be or do who you could really be. And I'm so grateful for me, to be honest, that I left that world 22 years ago and was led to something like this eventually. If I had stayed there and I had taken the drugs and I had done all the botox, I wouldn't have been able to do the things that I have in my life. And I'm not saying that in the wrong way, but I've been able to do athletics at a national level competitively, and just learn and do other things. Now I work in nutrition and I help other people, so I just believe in the human body a different way. And I'm so grateful that's what led me to you, and then learn about this, and then what could then potentially, what it's become now to help so many other people. So.
Hi, I'm Dr. John Lieurance, and I've recently been told that I've treated more cases of palatal myoclonus than anyone else in the planet. It's very humbling for me to have heard that. it's such a rare disease that most doctors may have only treated 1 or 2 cases. I've looked through all the literature, and the hope that's offered through traditional medical care is very limited. In fact, it's really limited to drugs, which are very ineffective and alter your lifestyle and your ability to appreciate your life drastically, and botox injections. What we've been able to work with here is functional neurology and the use of specific endonasal balloon releases to the skull and the cranium that allow the body to heal itself through improved oxygen and decreased tension of connective tissues in through the skull. We're also continuing to learn more about this condition. As I see more patients, I'm including more protocols to the different patients that I see. One thing that I've noticed is not all patients are the same. There's been a couple of dozen patients that I've seen here, and they're all a little bit different in different ways. And so we try to take a unique approach to these patients. If you have palatal myoclonus and you've made it to this website, you're halfway there. In fact, Chris just said that. You're halfway there. I congratulate you for persevering and looking beyond just what your medical doctor's telling you is available. I offer that you contact me via email. It will be made available for you to talk to other patients with palatal myoclonus about their experience here. Thanks for joining me, and if healing is possible, consider it to be within your reach. Bye for now.
Peace out.
Hi, this is Dr. John. Thanks for joining me. If you or a loved one suffers from difficult neurologic conditions that no one seems to have answers for, send them to functionalcranialrelease.com. You can contact me by phone or email me at AskDoctorJL@gmail.com. And remember, if healing is possible, consider it to be within your reach. Bye for now.
functionalcranialrelease.com